The Republic of Armenia declared its independence from the Soviet Union in 1991. However, the healthcare system continued operating under the same old Soviet-era rules and approaches. According to Armenia's Ministry of Health, breast cancer was the #1 killer of cancer deaths among women in Armenia, followed by cervical cancer. In April 1997, in response to this crisis, the Armenian American Cultural Association, INC, from the United States, headed by Rita Balyan, organized its first medical mission to Armenia, and together with Ranush Hakopian, who was then the Minister of Social Welfare and presently the Minister of Diaspora Affairs, established the Armenian American Mammography University Center on the campus of the Yerevan State Medical University and registered it as the first non-profit entity in the country as a foundation. In 2000, the U.S. Embassy in Yerevan and the USAID Armenia Mission began a partnership with AACA through a grant to further promote American healthcare practices and principles in the early and accurate detection of breast cancer for the women, mothers of Armenia. In 2002, the Armenian government, through a presidential decree, donated the entire Soviet-era building to the Wellness Center. In 2004, together with USAID American Schools and Hospitals Abroad program and its many donors throughout the USA, the AACA reconstructed, expanded, seismically reinforced, and renovated the 5-story building into the present-day 6-story modern medical facility, using Armenian architectural design and American engineering structural expertise.
Այս կենտրոնը հիմնադրվեց եւ դրանից հետո սկսվեց աշխատանք.
This center was established and after that work began that required a lot of energy. And of course by the large investment of Ms. Rita Balyan and our very respected and beloved Mr. Balyan, who passed away untimely. They invested all their capabilities to create this center. Thanks to Mr. Balyan, we had the magnificent building, which is really one of a kind in Armenia. As a result, daily 150 to 200 patients visit the wellness center to receive medical services by doctors who are trained on-site in Armenia and in USA. Presently, there are 10 departments providing quality medical healthcare to women and their families. The departments include: Breast Screening and Diagnosis Department was established in 1997. The breast screening and diagnosis program currently screens 80 to 100 patients per day and up to 150 patients per day during Breast Cancer Awareness Month in October. Since 1997, AACA's President Rita Balyan has organized medical missions that have focused on providing training and exchange opportunities for the Wellness Center staff, involving AACA's U.S. Medical Advisory Board members Michael Parson, mammography technologist Dr. Ann Archer, breast health radiologist Lawrence Mowat, then biomedical engineer from the U.S., who trained the AAWC's physicians, technicians, and biomedical engineers. 2 3D digital mammography systems were installed in March 2012, representing the latest technology called Selenia Dimensions tomosynthesis system. Installation of 3D systems took place in March 2012 and training application completed in April 2012. The establishment of the gynecology department in 2001 opened a new chapter not only at the Wellness Center but also in Armenia. Routine cervical cancer screening wasn't widely available in Armenia prior to 2001, when AACA arranged for a partnership between the Wellness Center and Dr. Emma Zargarian of the Greater Baltimore Medical Center, affiliated with Johns Hopkins University, to create a gynecology department.
We do all examination, as I said. This is a pap smear examination, next vaginal smear, ultrasound examination, and treatment all diseases.
The center staff began treating infertility, approaching the problem with the perspective shaped largely by the training they had received under the guidance of Dr. Emma Zargarian. The center is also taking a great pride in the birth of 176 miracle babies born to couples who had struggled with infertility for 4 to 12 years. A pathology laboratory was established in June 2001 for the study of cytology and histology tests and diagnosis. To enhance accurate and cost-effective pap smear readings, Rita Balyan has organized training in cytology for 3 doctors from the center at the University of Southern California under the direction of Dr. Camelia Kopp and Catherine Berberian. In July 2003, family medicine, endocrinology, and dermatology were introduced by 3 American doctors of Armenian origin, Dr. Vigen Puchikyan, Dr. John Puchikyan, and Dr. Christina Aawc, who kept on flying from California and metropolitan Washington, D.C. area to train the doctors until today. In 2003, a satellite clinic was opened in Gavar, a town 60 miles northeast of the capital city of Yerevan in the Lake Sevan region, where breast abnormalities among women are the highest in the country. A 2-room house was extensively renovated and is now a modern 10-room healthcare facility providing primary healthcare services, including breast and cervical screening, and women's reproductive healthcare services to the vulnerable population of Gerarkunik Mars, 250,000 residents. Dental health with 2 dental clinics and a lab was established in May 2013 with the most modern dental equipment from Germany. It was established under recommendation and assistance of George Washington University's Emeritus Professor of Immunology, Dr. Julia Albright. Ambulatory outpatient surgery was also established in May 2013 for lumpectomy, mastectomy with breast reconstruction and nipple-sparing techniques, as well for gynecologic, urologic, orthopedic, and plastic surgeries and procedures. After surgery, post-surgical rehabilitation activities are aimed to return a patient to normal life, both physically and psychologically. Laser treatment of facial vessels and skin pigments through Candela V-beam laser is performed by the center's plastic surgeon. The Diagnostic Imaging 9th Department was established in December 2015 with the installation of 2 very advanced digital units. The first one was a CT scanner Toshiba Aquilion Lightning, which reduces radiation exposure to the patient up to 75% to 80%.
Our state-of-the-art CT scanner allows us to minimize the radiation exposure up to 80%, which is very important because most of the patients that come to our department, those are patients who have some kind of oncological disease. And for them, it's very important to get follow-ups every 3 to 6 months. And with the opportunity to minimize the radiation exposure.
The second unit was a digital X-ray unit, Toshiba Rafin, with a rotating arm that provides patients with complex, precise, and comprehensive examination without inconveniencing the patient to move in different positions. However, the first diagnostic imaging unit for osteoporosis screening, DEXA unit from Hologic Corp, was installed in December 2006 with efforts of Rita Balyan being the first to introduce it in Armenia. Orthopedic department was established in December 2016, where the qualified specialist performs a wide range of interventions of injuries and orthopedic diseases. Multi-purpose conference hall with 250 seat capacity located on the 5th floor is suitable for scientific and medical conferences, meetings, seminars, and live surgery presentations. Since 1998, the Wellness Center has been involved in organizing outreach medical missions in 94 remote towns and villages, including 349 missions in Armenia and 5 medical missions in Artsakh, and provided over 28,150 free of charge medical services to more than 22,097 patients, using the latest portable systems for breast, abdominal, and osteoporosis screenings. AACA has trained AAWC to organize lectures at public gatherings and yearly health walks every October in observance of Breast Cancer Awareness Month. Health walks are led by the U.S. Ambassador of Armenia, AAWC co-founders, the Minister of Health, as well as 3,000 health walk participants. For the past 20 years, from April 1997 through December 2017, the AAWC achieved tremendous success and accomplishments. 160 to 200 patients visit the center daily. 7,779 patients' lives saved. 417,498 patients served. 530,254 medical services provided. 272,647 breast cancer screenings and diagnoses provided. 150,907 gynecological services provided. 176 miracle babies born since 2004. 30,447 family medicine services provided. 2,559 male patients received urology services. 22,036 patients served during medical outreach missions. 4,298 patients received surgeries. 5,084 CT scan and X-ray imaging and diagnosis provided. 51,285 cytological and histological services provided. 3,125 dental services provided. The role of AAWC as a unique medical center in Armenia is vital for accurate diagnostication of the diseases, their timely treatment, and utilization of successful preventive healthcare to the Armenian population. Advanced and new technologies will allow AAWC to further provide patients with the highest and most efficient level of medical services. Each time we save a mother, we save her entire family, her community, and thus her nation. Rita Balyan,